know we have a small group today, but maybe some more people will hop on. If not, we'll make some progress on our own. So just to break the ice today, we want to know if you guys have any unique talents or quirks. If you do, share them with us. So let's see. What am I going to put?
Careful what you ask for.
Yeah, I know.
I have to get this pulled up. Can you show the QR code again? Sorry.
Oh, for sure. Yep.
It didn't quite.
There you go.
Take. There we go. Thank you.
Yeah, be careful what you put. It's such a small group. It might be easy to guess. Nice.
Interesting.
Yeah, I'm the beatboxer, but like I said, not the time or the place. I'm not going to show you guys that, unfortunately. I love sea turtles and I plan vacations around it. That's great.
Like
awesome.
To go see like sea turtles hatching or sea turtles nesting, things like that.
Yeah, like places that sea turtle rescue centers. I still haven't seen the babies hatching on the beach, and I sat out with the volunteer lady one time and was just waiting for those eggs to hatch on vacation, and they never hatched.
Oh my gosh,
that'd be cool to see.
That's my bucket list. See the baby turtles coming, and going out to sea. One of these days.
I saw it. I was on vacation in Tulum, Mexico, probably 15 years ago, and was just sitting on the beach, and down, a quarter mile away, or maybe not that far, I saw a bunch of people, pointing and like calling other people over. I went over and a nest was hatching, and probably, how many turtles are in a nest? Like 30 or 40. It was just amazing to see it happen. These tiny little things, and they're struggling to get across, the sand. And then as soon as they get into the water, they're just like, whoosh.
They dart out.
Yeah, it was.
That's awesome.
It was good.
My Facebook profile picture used to be a picture of me holding a big snapping turtle. Melinda, we used to catch them up in Wisconsin and then let them go and catch them the next year. That's awesome. Okay, somebody else said every lost child comes to me in a crowd. That's great.
True. If there's a child lost, they're suddenly attached to my leg going, "Where's my mommy? Where's
Oh, that says a lot about you, Amy.
You look very friendly and approachable, I guess.
That's right. All right. We got one more for you guys. Have you ever developed messaging, branding, or media content to promote healthy lifestyles, health, or physical activity? If you haven't, that's okay. Is there anything that you'd like to focus on in the future for your organization or just in general or for the KCPA plan? Nice. Yep, of course. Bike Walk KC, developing content around the health benefits of active transportation, messaging around that included health and financial health and wellness through HSAs. Heck yeah. Let's see if mine posted.
Oh, Ashley says her Mintent's not working. Or her
Oh, no problem, Ashley. Create a toolkit for sun safety social media messaging. Awesome.
Very cool.
Cool. And then in college, I created like a dental health application for kids to play games and stuff and learn about how to take care of their teeth.
I love
a lot of different areas that can be filled. That's for sure.
Smile Dial is very catchy.
Thanks. Yeah, they would spin the dial and you can play a game, or you can play like tic-tac-toe for different dental health stuff. It's a fun little project. All right, so on to the next thing. So this is our original mass media logo on the left-hand side of your screen. Well, actually, I guess I'm sharing my screen so you guys can see this. I suppose you can also see it on your phone if you're still on the Mentimeter, but probably not very well. So to the left is our original logo. And in the past month or two, we've been revising a lot of our graphics for the KCPA plan, just to be more inclusive of people of all abilities. So we also want to, take into context diversity and inclusion. So obviously including people of, all sex, ethnic background, etc. So what we did is we made some small changes to our logo, and we wanted to know what you guys think. So we've ran this by Melinda. We've ran this by our core work group of the KCPA plan, but we also wanted to bring it to this setting as well. So if you guys have any recommendations for what you think makes sense for a mass media logo, if we should include people of different body types, people of different ethnicities, someone in a different situation than we might be in, please let us know. Feel free to type something right now if you'd like to on your phone, or let us know what you think of this logo. Otherwise, if you want some time to think on it, we can definitely share the logo with you, and you can get back to us in the next week or so.
Hey, Bryce, can you talk about like what the options are for images? Like you've got a big bank.
Sure. Yeah. So basically what we do to create these images is we use Adobe Illustrator. So we have a paid plan for that. So we can basically access any type of character that we want, doing different sports, doing different activities, different images in the workplace. I can change the colors. I can change their skin color, their hair color. And then something that actually came to my mind that I haven't really considered in the past, I try to keep things like relatively cohesive for the KCPA plan so that the characters like kind of look similar. But Melinda said, let's include people of, different shapes and sizes, which totally made sense to me. So I think my next approach is going to be searching a little bit more around like getting more, various body types included in these graphics. So, we basically have free reign to create what we want in Adobe, which is nice. How will we use the logo? Sizing may be an issue. Yeah, so it is a long logo. You're right. And we added more characters to this. As far as like using the logo, I think it should be fine as long as it looks consistent to the others, which this probably is the longest logo. So that's actually a good point. And something that I should consider when I compare all of them before adding them to the plan. But I guess to elaborate on that, we use this in the actual paper KCPA plan. We use this on our strategy cards for each of the strategies in the KCPA plan. And then we also use this on our website and any like social media posting and other graphics.
And the only thing that I would see, the girl that's sitting down with the laptop on her lap, maybe change her dress color, because when it was bigger, I could see that there was a laptop, but when it's smaller, you can't.
Gotcha. Yeah, because it blends in with the table kind of.
The girl that's sitting not on the floor, the one in the chair. Yeah, that one.
Oh, gotcha. Okay, so it kind of blends with the background. Cool. Okay. Yeah, that's good advice.
And also, what is that pink thing on the people on the side?
Oh,
it's in his hand.
The microphone.
It's a microphone, and that's another good thing. Like, No, that's
it kind
that's
of
a good
looked like
comment.
it was ice cream.
Yeah.
Yeah, it was.
Yeah.
It almost looks like that. Yeah, I'm gonna go change the microphone color.
Microphones have come a long way.
Oh man.
I mean, it's a
else
good point because, you know, some things, you know, like for sport, it's easy to pick images that reflect sport, you know, but for mass media, I guess what actions represent mass media, you know?
Yeah, I like the actions that you have there. I couldn't really think of anything else. And I don't know, like, and as far as body types, you know, that suggestion, and I don't know if it needs to be incorporated in this particular logo, but that came to mind for me because you did have one that was a different body type, but then it was just one. Mm-hmm. And so I think that's where maybe throughout some of the other logos, especially where we're trying to get that are more about the community, that like you're encouraging, you know, all shapes and body types to be physically active. So I don't know if it applies as much to this particular logo as some of the other logos.
It's a really good point, Melinda. So I'm glad you brought it up.
Yeah, that's really good advice, Melinda. And actually, after you sent me that email, I went back to look at some examples. I think infrastructure did a pretty good job of like mixing different people in like that. Take a look real quick. Yeah, that's a pretty good mixture of people. Cool, awesome. All right, well, if you guys have any other additional comments that you think of after, feel free to shoot us a message, but we appreciate your feedback. Yeah,
and as I said to the other groups, that nothing that we do in this work is written in stone. So we can change it at any time, even if, you know, if it's a couple months from now and you're like, hey, wait a minute, I've got a good idea. We can address it then as well. So
absolutely.
Great. Okay, well, yeah, thanks for coming today, everybody. It's been a long time since we met. I think it was November 28th was our last meeting. So just as a recap, we spent October and November discussing the strategies for the mass media sector. And Bryce, I know you have an order here, but maybe can you pull up your mural board real quick?
Absolutely.
Looks like you got it in that tab. Yeah, and if you could go, whoops. Yeah, just scroll up to what we did before. So hopefully this rings a bell. We did a couple different prioritization and other discussions around the 4 strategies. And they're all represented in the mural board. And I guess, Bryce, maybe do you want to post the mural board in the chat so they can access it? It is in the newsletter that is somewhere in your email inbox. We also have, I believe we have a link to all the newsletters on the KCPA plan website, Bryce, or is that not up yet or not live yet?
I don't think it's live yet, but it might be after Thursday.
Okay. So. I know sometimes it can be hard even for me to find our newsletters in our email because it comes from a weird address. So we will be posting all the newsletters that have all the recaps for all the sectors on the KCPN PA plan website. That's, if it's not up now, it's going to be up in a couple days, so you can revisit that. But you have access to this mural board at any time and reread what we talked about, or you can add new comments. We now are to, if you remember, the national plan has kind of 2 levels of planning. They have the strategy level and the tactic level. And the tactic is more broad broad ideas, whereas the tactics are more specific objectives to accomplish the strategy. And so now that we're through with all the strategies, today's ask is to go through all of the tactics for each of the strategies. Each strategy has somewhere between probably 2 and 6 tactics, or excuse me, it looks like the highest was 3. So
yeah, this is one of the fewest, I guess, like tactics under each strategy for any of the sectors. So we might go through it pretty quick today, but like Robin's going to talk about, we can always add more if we need.
Yeah, and so in discussions with Melinda and Toriano, what I think the best strategy today is, we're going to start out by doing priority rankings for the tactics to get like a number value for the importance of the tactic. And then we will have an open discussion about the tactics where we can flesh out anything that may not be clear when we do the priority rankings. And our goal is to get through all the tactics today. It should be quite feasible. And then at that point, we will have done all of the group work for strategies and tactics. We'll go off between January and February meeting, and we'll bring everything into one cohesive document. And at the February meeting, we'll spend part of our time reviewing that document and everything we've discussed up to that point. And then I'm trying to connect with the national plan mass media sector lead, and we're trying to get her to join us for the second half of that meeting, so we can, kind of show her what we've come up with, and then she can tell us about what has already been done at the national level and where their priorities are and how they can help us. So basically, we've got kind of this month and next month, and then that'll kind of end the planning phase. And then we can decide what happens after that. All of the other sectors have moved into implementation projects, but we can talk about that a little bit more next month. I think that's where most people get really interested, is actually doing some of the things we're talking about. So I'm assuming we'll go that way, but ultimately it's up for the group to decide. So any questions about what we're doing today or next month? Okay. Well, let's just go ahead and go right into the tactics for strategy 2. Actually, Bryce, could you go up into the mural board and let's go over what strategy 2 is, first of all?
Yeah, good idea.
Strategy 2. So this was our highest ranked strategy from our initial polling. And strategy 2 is physical activity professionals should partner with communication experts to develop mass communication messages and a standardized brand for the promotion of physical activity that is consistent with current federal physical activity guidelines. So the tactics that we're going to pull on now are all related to that strategy.
So the way we're going to vote is you guys can go back into that Mentimeter. If you closed out, you should be able to go back into your browser. Otherwise, you can go to menti.com, enter that code, or you can follow this link. I'll throw it in the chat.
Oh, it looks like you closed the voting.
Oh, did I?
Yeah, it looks like it's closed.
Voting is closed.
And just while he opens it back up, we recognize that the wording of some of these strategies maybe is you might have a question about or something like that. We will discuss like the specifics of each tactic after we get done with the polling. So for example, if you think something should be done, but you don't like who the tactic identifies should do it, you can just continue to rank it as whatever you think, and then we'll talk about whatever issues you have in the open discussion. There you go.
All right, it should be open now. Let me make sure it's not on anything else. Cool. All right. So we'll start with strategy 2. There's 3 tactics for this strategy. And you can vote on each of those 3, and then you'll hit submit at the bottom of your screen on your phone. Let me know if you guys have any issues.
And I guess, yeah, was everyone able to vote? Or I guess, Ashley, maybe we're still having issues.
Cool.
It worked. Okay, great. Perfect.
Awesome. So what I'm going to do now is I'm going to screenshot this and I'm going to share the mural board. And then as we start our conversation, I'll just post this data into that board so you guys can reference each of these tactics. Right. And then these are just some things for us to consider as we start the conversation on each of these things. Give me 1 sec. I'm just going to screenshot this.
Thanks to Bryce for handling all this technology.
No problem.
Between Mentimeter, mural boards, Evites, MailChimps, Bryce has developed a lot of skills that he probably never knew he was going to need. Okay, so all of these really ranked pretty high. And so as Bryce showed, things that we can discuss in this period is what might be some barriers to accomplishing or making this a priority, who would implement it, is this already being done, does this need to be tailored for the region, and anything else that you guys want to discuss. So maybe we can start with just the first one. The first one ranked a little bit lower than the other 2. And any particular reason anyone would like to share, or why they ranked one higher than the others? I know I will just say that for number 1, this specifically calls out public health agencies for developing the brand. And I'll be honest, I don't think that that's realistic, especially in the current climate, given, we couldn't ask KCMO Public Health Department to, hey, I know you're busy with COVID, but we would like you to develop a physical activity campaign. Just talking with them, we are developing a public health sector, and there's a lot of interest in participating, but they've pretty much made it clear that the earliest they could participate in that would be the fall of this year. So even now they're still obviously quite focused on other things.
I think, and actually related to what you just said, Robin, for me, the conducting market research is, if we could get a professional to do that, I think particularly in this day and age with COVID, how are people going to approach physical activity and what it means to them? For some, it may even have greater importance. I just think there's a lot of potentially interesting ways that COVID and quarantining and this whole pandemic may affect messaging in ways that I can't predict as a communications person. So I know that it takes resources, and I'm definitely not someone who wants to just do research for the sake of doing research. I really would like to see, is there some messaging that might be quite unique to this point in time that we're in?
That's a great point. And maybe, I guess, related to that, I've obviously never done this before. I know Bike Walk KC has done some recent, I guess, I'll let you maybe describe what Bike Walk has done with the brand analysis. And if something like that is related to something like this.
So we were able to engage with a volunteer agency to help us with that. So if we could, and Brad Long, I don't know if he's on, he is part of that agency. It really helps to have a professional come in, because I don't feel qualified to do the kind of research. So if we could find someone who could donate services, and I feel awful, I'm like totally blanking on Brad's agency, but something
like Brandwell.
Brandwell, yes. Thank you. That would be ideal, is to find those donated services through an agency like theirs. And if Brad's on the subcommittee here, he'd be the logical one to go to see. And it's just a process. They test messaging, they develop messaging. They'll take a look at everything that we've done, so they understand where we're coming from, what our objectives are, what do we want to achieve with the messaging, and then express our concerns, or why do we're just like COVID and the pandemic, like that's an uncertain. That's an unknown in terms of how that may impact message development and also reception of the public's taking in the message and processing it. And then they'll develop messaging and then test it with focus groups and to see what really resonates or not. For me, getting that research and results in place helps make the most out of the tactics 1 and 3, because we don't want to develop messaging that is going to fall flat, or missed opportunities, that kind of thing.
And I know they worked on, I think it was the latest Children's Mercy campaign as well. That being said, it sounds like they're really busy, and I don't think we've heard back from them on what's going with the Bike Walk initiative. So it may be good just to, with this group and their contacts and maybe some of the agencies that they work with, is to identify maybe 5 different agencies that we could approach that might have some availability.
And do you think, and I've shared throughout the fall, just, kind of random campaigns that I've seen either nationally or in other parts of the country. Thoughts on, co-opting some other existing campaign versus doing something that is very specific to our region and very specific to the KCPA plan?
That would be better message testing.
Mm-hmm. Yeah, I think there's definitely some pieces that we would be able to adapt to our plan. And I think I'm excited to hear, and I forget what you said her name was, the person that is leading the marketing initiatives for the national plan, to see what has worked for them and what hasn't worked. And I think we'll get a lot out of that after hearing her speak on kind of what strategies and tactics have worked best for them.
Yeah, and I'm sorry, I'm pulling that up right now. I forgot her name as well. And let's see, I think I've shared these before, but I'll throw them in the chat. These are the materials that the national plan has released. Either it's a little confusing. There's the plan itself, and then there's also the Physical Activity Alliance is the organization that kind of is serving as the backbone organization for the plan, similar to like what Wagon is. So you'll see in those two links, it's on PAA Move With Us is that organization, Physical Activity Alliance. And yeah, there's some good information there, obviously. Okay.
And I think that you know tactic 2, once that is, there's been some research done, that will really help facilitate number 3, or what's on number 3 in the Mentimeter down here, the developing the toolkits.
So tactic 2, strategy 2 probably is, if it's not the top of our to-do list, it would be near the top for sure. Because of kind of the order it sits within other things. What was tactic 3 again, Bryce? Sorry. Oh, yeah, the toolkit. Yeah.
So do you guys have any input on, like, I guess not necessarily comparing the two, but maybe contrasting developing a standardized brand for physical activity promotion, or like a toolkit to support messages? And I guess it also says the brand. When I think about this, I tend to think that people are sometimes maybe pushed away from physical activity or like health promotion campaigns when a brand is kind of trying to be kind of like forced upon them, instead of like integrating it into what people want to see or what they're used to, their lifestyle, etc. That's where I think if we're able to like adapt a toolkit to fit different sectors and meet people where they're at, it might make more sense than like a specific brand.
I think that the brand is giving recognition to what the KCPA plan is. It's like, I know what this is because of the branding. This is associated with the physical activity plan. It's the look and the tone of the message, and then that overall branding is infused into the specifics of the toolkit.
Gotcha.
Yeah, I think of the toolkit as, say we have 6 target markets or audiences, and we know they each, in order for for them to engage with the brand and do what it is that we want them to do, they may need very different tools from one another. So if we're talking about working with small children in daycare centers, it's just the first thing that comes to mind, that's going to be different than working in trying to engage, you know, high schoolers or senior citizens. The tools will be a little different. So
gotcha.
Yeah, so this is actually a really good question. So the campaign you think should be around promoting the Kansas City Physical Activity Plan, and then there are specific toolkits to promote safe and equitable physical activity within different sectors of society.
That's how my brain tends to work in terms of, especially when we're trying to engage like the region. That's huge. I have to start thinking about what are some of the key organizing groups that we want to target. And so, yeah, I mean, that is definitely how I approach it. Melinda, in your work, is that?
Yeah, I think that's exactly how I was thinking about it too.
So just to flesh this out a little bit more. So let's just say we've got a campaign increasing awareness about the Kansas City Physical Activity Plan with the goal of getting more organizations and neighborhood groups and individuals participating in what we're doing. And let's just say I'll just pick Johnson County Parks and Recreation. They say, hey, heard about you through this. And then you're like, great. Now here are some tools that we can provide you to help create safe and equitable opportunities in Johnson County parks.
Mm-hmm. And so to take that a little bit further, it's funny, I just got done doing this for Bike Walk KC. I was creating personas. And so when you create a persona, you try to make it specific enough that you realize that it's a certain sector or area of the public, but specific enough that you can tailor messaging and engagement tools. So, but the questions that I ask are, like I just did one, Daisy donor, just like regular donor, we want donors to come to Bike Walk KC. So what are her goals and what are her challenges? And then how does Bike Walk KC help her overcome challenges and meet her goals? What's our unique value proposition to her to do one or both of those things? And that helps you understand what kind of tools that she needs, you know, and so I think we could do something similar here, because it gets really overwhelming to try to say we're doing this campaign and brand and engagement for the community. We need to slice and dice it a bit more to make those toolkits make sense for each of those sectors.
Mm-hmm.
That makes a lot of sense. About 10 years ago, Weighing In was part of a national learning collaborative through the federal government, and it was connecting healthcare systems to the community. And so we created the 1, 2, 3, 4, 5 Fit-tastic messaging campaign, and that was specifically for pediatricians and pediatric healthcare institutions to use that messaging for, you know, their patients and families to become more active and to eat healthier. And you know, it's quite good in that respect, but of course it's not good to try to get, you know, a 30-year-old to join KC Crew and do, you know, recreational, you know, pickleball 3 times a week or whatever.
Yeah. So Robin, just for your example for Johnson County Parks and Rec, it's like, what do you think their goals are that we can help them achieve, and what are the challenges? is the more that it makes them go, well, duh, of course, if I help you do that, it helps me get more people to the parks, or it helps us, you know, create an event that they can raise some money on. I don't know. You see where I'm going with that? Like, what do you think would be one of their goals?
I guess the other piece to all that would be, you know, the Parks and Recreation sector has their strategies and tactics around, you know, there's one around, you know, creating, you know, neighborhood opportunities, creating a surveillance network, and engaging with communities so they have input, right? So I guess at some point, then the messaging is about maybe convincing Johnson County Parks and Rec to do some of those strategies that have been developed. So it's kind of almost, it goes both ways, I guess. Engage with us, and likewise, we think these are priorities in the region for the Parks Department.
That's where a lot of, you know, some of the focus that we need for these individual sectors can come from those existing working groups when we partner with them. And maybe even to a certain point, it sounds like some of them have done some research. So if they have already done the research, that may take off the burden of using kind of an outside agency to do research for us, and taking that, and that could be at least the first step for those that have already done some existing research, and how we can, you know, create our plan that from that.
Yeah, and that sets us up to do a gradual rollout, which I think is fine. If we say, if Parks and Rec are sort of the gatekeepers to the largest number of the public that we can reach right away, and they're open to it, and we understand what their goals and challenges are and can give them a toolkit for that, then we could save an agency or tap a volunteer professional to help us with the groups that might not be as easy to reach.
Right.
We're running into resistance.
Right.
Does that make sense?
Yes.
Is there like the school education group, and if they've done some of their, it sounds like they may have done some research as well. That could be like the focus, or
yeah, well, or, you know, and the example that I used with the Fitastic messaging campaign, you know, that was what agency? There was an agency that was hired. They've changed their name, which is why I can't remember it now. But, you know, they did all the market research around that messaging, the graphics, and all that information. So, you know, like for that specific pediatric healthcare system, you know, maybe that piece is already done, but maybe for adults, like I said, that's the missing piece, or specific subgroups or something. Yeah. Great. This has been a great discussion. Just in the consideration of time, anything else just burning with these set of 3 tactics before we move on to the next? All right. Yeah, strategy 1 tactics up next, Bryce. Is that what we got?
Yeah, let's do it. So we can go back to that Mentimeter. We'll do the voting, and then we can get started with the conversation. All right.
And I guess maybe, sorry, if you could, I'm making you switch sides. Can you read the strategy 1 again?
Oh, absolutely.
Narrow board.
Yep. All right, strategy 1.
The second highest ranked strategy of the 4. Government health agencies, in collaboration with nonprofit health organizations, should launch a regional physical activity campaign to educate individuals about the effective behavior strategies for increasing physical activity. So I guess maybe the nuance here is the previous was about messaging, and this one is more around behavioral strategies. And I think maybe the tactics will get into what that might mean when we look at the tactics. Yeah, so I think the nuance here between the previous one and this one is, messaging around physical activity. And this one is more about how to become more active, walk for trips within 3 blocks or something like that from your home. And I will just say, for tactic 2, it's about federal funding because we got this from the national plan, but you could substitute, regional funding for probably our purposes.
All right, awesome. Not sure if Brooke had a chance to vote or not. We'll give her another 15 seconds or so, and we can go back to our mural board.
He's having some dog issues right now.
All right. No problem.
Dog issues, huh?
Yes, she said that he just destroyed 2 toys and is currently eating them. So I think she's having to wrestle those pieces away.
Understandable. In one meeting, I was sitting in this spot, and there's my back door is just to my left here. And during the meeting, my cat came up to the back door with a bird in its mouth.
Oh.
So I had to do a quick timeout and try to rescue the bird, which I was. He didn't kill the thing, luckily. He just brought it for me as a treat, I guess.
It's amazing how COVID and working from home has just made us switch gears so fast and seamlessly, like from rescuing a bird from our cat's mouths to leading a high-powered meeting.
I know, right? Exactly right.
Few feathers here.
Exactly. Yep.
Great.
Okay. So again, both of these ranked actually pretty high. Tactic 1 and 2. The second one looked to be a little bit higher, but they're all pretty close. Any comments?
I think for me, if we're talking about government agencies, like if there's not, to get them engaged, if there's not money to supplement their budgets to help with this, I'm not sure how much good messaging is going to matter.
Yeah.
It's kind of where my head was in rereading it.
Mm-hmm.
Mm-hmm. And I think kind of to your point, Robin, too, is like maybe it's more of looking at more local agency funding than federal funding.
Just kind of on that topic, and this doesn't have to be specific to physical activity, but is anyone aware of a media campaign being funded by like a local foundation funder?
Yes.
For physical activity specifically?
Yeah, just for anything. Like I'm just wondering if this in general is realistic to say, you know, let's just pick Health Forward Foundation. Let's say, would they ever fund something like this? Probably they're a bad example, but Kauffman Foundation, we'll say.
Mm-hmm.
If it fits with their funding strategies and we can make the case for it. The example that comes to mind is Menorah Foundation with some of their grantees, because they're focused on behavioral changes and healthy communities. As that campaigns, I don't know if they've done it just, that's the only thing they funded, but as a grantee, some of their grantees have incorporated awareness campaigns in their grant proposals, or as part 2 of their, you know, do the necessary work and then launch a campaign. So it's not unheard of. It's just making sure that we can demonstrate that what we're doing is also going to really support their funding priorities.
Yeah, and that's kind of what I was getting at is, you know, a lot of these funders, you know, they sometimes have unrealistic expectations of outcomes. You know, they think, you know, well, the outcome of this campaign should be, you know, reducing the food insecurity by 25%, you know, and how does, you know, a social media campaign do that? No, you've got to, you know, send boxes of food to people or something, you know, so sometimes it can be hard to connect something that is not directly related to, you know, like a physical, tangible outcome to the ultimate goal.
That's where I think. Go ahead, Melinda. Go ahead.
And I was just thinking of, you know, if this is, you know, from a corporate sponsorship, and then, you know, always wanting something tangible in the form of their branding and promotion, this could be a good opportunity if we are, you know, really trying to get this out on social channels and being picked up, you know, by media stories, is, you know, having like a major corporate funder where their logo always appears with the physical activity logo. So it's the Kansas City Physical Activity Plan, you know, sponsored by, I'll just throw them out because they're always Garmin, which maybe they're not, they don't always seem to be the best for things, but just thinking of a company that has kind of a health and wellness mindset, or Blue Cross Blue Shield, Kansas City, something like that, that you get an overall main corporate funder that would have a lot of branding opportunities with the promotion of the plan.
And
or, you know, oh, yeah, sorry.
That money's coming out of mostly their marketing budget. So, which is a great way, because if they have buys and things already paid, media opportunities, sometimes they can then make room for us to latch on to some of that collateral material, which would be great.
Yeah, and this is where maybe getting to like what we talked about with sector specific campaigns, you know, I could see, let's see, you know, like the Kansas City Royals, you know, supporting a sports sampling program, or you know, something like that.
I'll throw GEHA in there. I think is one that we should figure out how to introduce you, Robin, to Gene Willis at GEHA.
Yeah, that's a really.
I mean, this is health, community health, individual health. That is very much a part of what they're about. I mean, Bike Walk KC is just starting to forge a relationship with them. But I think it would be worth reaching out to them, Robin. Maybe you and I and Eric from Bike Walk KC, we can talk about doing that intro for you.
Yeah, absolutely. Absolutely. Bryce is doing so good to sketch everything out. I'll just throw out a comment for tactic number 1, which was I think market research on behavioral change campaigns and strategies. I do believe that there has been a fair amount done about techniques just to get people more active in general. And, those aren't regional specific or sector specific, but they're just kind of general psychology principles around messaging that probably could be taken from other existing work and applied here. So it may not need to be done again, I guess is ultimately what I'm trying to say.
I think those are the messages that would be developed for the toolkits, and then it's just testing. That's just testing those messages that have been created.
Okay. I can take a couple notes and then we can move on to the next strategy if we think we've kind of covered this one. Maybe I can even.
All right. Sorry.
Help. Yeah, no problem.
Let's read through the next strategy.
Yeah,
strategy. We're on to strategy 3.
So professionals in physical activity and public health, so people like me, I guess, should inform mass media professionals, so I guess people like you, about the effects of physical activity on health and the effective strategies for increasing physical activity at the individual and community level. So kind of what I talked about in terms of some work has been done about how to, goal setting or whatever it might be. And then I think one thing that I struggle with as I give community presentations is as a researcher, there are very few things. And the only other analogy I saw was the effectiveness of COVID vaccines. COVID vaccines are extremely effective. And likewise, there is, 70 years of research around physical activity on health, and it's one of the second to COVID vaccines. It's probably the second clearest link between behavior and a positive health outcome. And so that gets me all excited, but sometimes I wonder if that matters to the general public. They're more interested into other things like, maybe saving money or being efficient or having fun or something rather than the benefits of health. So these tactics are related to that strategy.
And then let's see, this ended up being, let me double check real quick, our lowest rated strategy, I believe. I think we skipped 4, but we can just go back to 4. We'll do 3 first. Let me just double check to make sure. Okay, yep. So it ended up being 2, 1, 4, and then 3, but we can stay on 3 here. Just make sure that you're voting on the right one in the Mentimeter. You might have to skip through the 3rd slide.
Sorry. Sorry about that, Bryce.
No problem.
I hate in Zoom when you click on one of the boxes at the bottom, then that box shifts and you try to click it again and you click the wrong button. So sorry, that was my mistake. I will just say that some of these have to do with directly with the reports that I shared from the Physical Activity Alliance. One of the reports was, more than just exercise, communicating the positive effects of physical activity. And the other one was just about general communicating about physical activity. So when we're talking about physical activity, it's not, let's do a story about the person who's run a marathon in every state. It's doing a story about, the walking school bus program at this school that, has 100 kids participating in, something like that. And I guess while Bryce is getting that set up, maybe Amy, I'm curious as to, as Bike Walk KC has gone through some of this process, I suppose you get some people who are interested in Bike Walk KC because they like biking, they're the spandex people, but then Bike Walk KC obviously does so much more than just that. And so maybe how do you guys try to balance those two things, and is that relatable here? I think it probably is.
Yeah, actually, that's exactly why I was creating personas this morning for Bike Walk KC, was to figure out what are people's motivations for connecting with us, and how can we do a better job of helping them meet their goals, whether they can articulate them or not, with what we think their goals are in having a relationship with us. So it's really going back to knowing what our different target audiences are. So we work with urban planners at different agencies because we have an earned revenue stream for community planning. And so that's different messaging that we present to them than we do to the avid cyclist or the timid cyclist. So we're really trying to fine tune, like when we're talking about that need for us or that activity, who are we engaging with? Because it can't be everybody that we interact with. So that's, I don't know if that answers your question or not, but it's literally naming them. We even named one Hilda the Hater, because we've got people who, and they're kind of in our detractor personas, but there are, because we're so active on social media, some of the stuff we do stirs up some negative feelings. And it's not that I want to waste my energy trying to convince them, but I need a communication strategy to at least, neutralize the negative comments. So.
Exactly. Yeah, exactly.
We have some smart alecky names for our personas that I feel comfortable sharing with this group, but we might not do it out in the public.
Right. Remember, this meeting is being recorded, Amy.
Sure, right. They're descriptive, so you know which group we're talking about.
Leaked to the star, secret Bike Walk KC personas. Okay, so our rankings here were, I'll try to not take it personally, but having people like me educate media professionals was the lowest, and that's been pretty consistent, I think, throughout all the times we've asked it over the past several months. The other two were pretty similar. Just in general, I've noticed these tactics are ranking a little bit lower than some of the other ones, which I think aligns with how this strategy has been ranked a little bit lower just consistently as well.
I mean, I think the media, they're one of our personas, right? So we're going to develop a media toolkit for them that will hopefully capture all of those things that we identified in the strategy. the tactics. We want them to reframe, you know, it's going to Costco and purposely making an extra lap around, you know. Maybe don't do your grocery list in order, like make yourself walk and calculate how many steps you get doing your Costco run in a different way. Like that's physical activity. But the media needs to know how to kind of have fun with that. So our media toolkit would help them with that. What do you think, Melinda?
Yeah, no, yeah, like parking far away from the entrance, so get those extra steps in. Yeah, I think you hit it on right on the nail. So that, you know, it's talking about the like you said, not the marathon runner. Not that you wouldn't want to do that, but just, you know, those small steps that you can take to improve your physical activity, and how that can gain momentum and keep you moving forward with bigger goals.
Well, and I would say the theme this past 7 days on bike Twitter has been that if you're truly interested in climate change and doing something about climate change, electric bikes are one of the best things you can do, more so than electric vehicles. And, you know, so that is like, that's not talking about physical activity. That's talking about, that's reaching the person who's interested in climate change. And, oh, by the way, you're going to become more active by getting that electric bike.
We call him Eduardo the environmentalist.
Wow, you guys are good.
Yeah, there's so many ways to hit the environmentalist, you know, walking, and instead of getting in your car to go 3 blocks, which I know a lot of people do. So.
Yeah, for sure. And actually I have one of my good friends from graduate school. She now is a researcher on human canine interactions, specifically around how you can use dog ownership as a physical activity intervention tool. So, you know, she enrolls people in dog obedience training courses, and they're called they're really stealth interventions where they're teaching the owners how to be better dog owners, which in turn makes them walk their dog more often, for longer, and they can increase physical activity, but the dog owners don't know that, you know? So.
Yeah, I not too long ago, I read an article about the health of a dog owner versus non-dog owners, and how they had like some percentage of living longer and being heart healthier, just because they were being more active with their dog.
Yep.
Whereas
exactly.
cat owners experience an increase in the likelihood of being murdered by their cats. So.
Yes. Yeah. Not my cat. I walk my cat. You know that, Amy.
You took the bird away. He's not going to be too happy with you.
Yeah. Oh, just the last one on tactic 3 about designing materials. I think we kind of talked about that with the toolkit piece. And this is might fall under the toolkit area, or one thing we've worked on in fits and starts is just basic white papers around physical activity, the benefits of physical activity across different sectors, just you know, like a 1-pager around, you know, more walkable downtowns, have higher you know, foot traffic through the doors, higher sales, things like that. So getting at the non-physical activity, non-health outcomes in like a little 1-pager. I think that it's a little bit different than the toolkits, but still something that might be helpful. So.
And I think that would be appealing to developers who are trying to do more like 15-minute city approach to design, right? So if we found some, what we call at Bike Walk KC like the holistic employer. They're really conscientious, or this could be the developer. They're really conscientious about making sure that folks have access, you know, by multimodal forms of transportation, active transportation to get to the grocery store, to work, to the park, that kind of thing. So.
Yeah, I just saw Councilman Bunch. He tweeted out something yesterday about that, you know, about how he was sitting in a coffee shop watching all the people from the apartment buildings walking to UMKC. Well, in my mind, it's UMKC, you know, School of Medicine or dentistry, because I see that as I'm driving to work. I see people in those new apartment buildings every day walking in their scrubs, the 3 blocks to School of Medicine, School of Nursing. Yeah.
Sometimes there's services that, you know, these organizations or places offer. Like I just found out the other day, I think a couple of weeks ago, that my apartment, which is just off Trolley Trail and then easily connects to the new bike lanes on Gillum, right to where I'm at right now at Children's Mercy, that the Ride KC bikes, we get like 83 minutes a day to use them.
You do. That's
so
that.
I've used it twice since then, and it's been really nice. I haven't done a full commute yet, but I need to try it out. Definitely.
Yeah, you didn't know about that, huh?
Yeah, I didn't know about it. It wasn't clear in the as I signed my lease agreement. So maybe I'll talk with them before I move out, that they should make it more clear to people, and they'd probably use it more too.
You can create a media toolkit, communication.
Yes, there you go.
Places, but they don't always use it.
Yeah, exactly. No, they actually put a nice little pamphlet in the elevator, and that's what got me the other day. So
fantastic.
Yeah. Awesome. All right. Well, we can move on to strategy 4. All right, so this one is focused on optimizing the application of social media and emerging technologies in media campaigns to promote physical activity. So I think we've kind of bounced around this idea with some of the other strategies and associated tactics, but we can maybe get a little bit more specific on how we can utilize these modes of media. So we can go back into the Mentimeter and do another vote. I think there's 2 tactics for this strategy.
And I guess since this is out of order, I'm on the wrong slide.
Yeah, let's actually go back to the beginning of this Mentimeter and everybody can scan again, and then we'll just.
Oh, there, strategy 4. Yeah, okay.
Yep. Okay.
I'm back in.
Awesome. And then, yeah, just double check to make sure you're on strategy 4, everyone.
I'm not entirely sure. It wouldn't surprise me if this strategy was originally developed maybe in the first round of the National Physical Activity Plan, which was about 10 years ago or so, when social media was maybe slightly more novel. I guess to me, as I look at this is like a no-brainer. Of course, you're going to use social media in a campaign. So I know that's why I voted it pretty low. Anybody else?
Yeah, it would be in the overall campaign as part of our strategy.
Yeah.
Platforms.
Yeah. The only one, I guess, that maybe with the second one is about emerging technologies. I don't know if it's emerging technologies, but emerging social medias. I heard the person who runs the social media campaign for a language learning app, dual language, or something. I don't do any of them, but she was talking about how, you know, they've got an edgy TikTok account and a more normal or more conservative Twitter account, and you know, and she talked about, you know, it's all about figuring out what the next social media application is going to be. So,
yeah.
Yeah, and I think this is a good example of how messages might change after a pandemic as well. I know in the past it was really hard to push public health initiatives and get people's attention on anything, you know, focused around health, or especially, you know, disease prevention efforts, et cetera. But maybe it'll be easier, you know, maybe it might be more accessible during the pandemic and after the pandemic. So definitely some considerations.
Yeah. And just, you know, generally speaking, one of the things I've learned from the pandemic is we need more. It is as much about messaging and conveying messages as it is anything else. And if you can have all the evidence in the world, but if you're not good at sharing that message, whether it's on social media or other places, you're always going to be playing catch up with people who are better at it than you, even though they might not be more knowledgeable. So, so I guess any other comments about these tactics?
I think the second tactic may be, I think that might be hard to do, is to really, you know, depending on, you know, what technology they're using now, or is that like talking about, you know, pushing things to smartwatches and having messages that, you know, are being utilized for things that they're not currently using and or have no interest in using. So that, I think it just might be a little harder ask to really support that tactic if there's no interest in, and it's not something they're already doing.
Yeah.
Or it'd be very specific to maybe a certain group. So I could see like schools using it as a competition, you know, those kinds of like Fitbit or to the smartwatch or whatnot, that it becomes, what are some incentives? And so for some groups, they may be motivated by tracking for competition's sake. But I don't think that's going to work for everybody.
Yeah, yeah. Okay. If there's no other comments, I think we've reached kind of the end of this this part of the process. So what generally happens next is Bryce and I will take a look at everything we've done so far, and we'll create basically the plan. We'll create a draft of the plan, and the best way to know exactly what that means is I'll paste the current plan in the here's the, just because we did it most recently. This is the sports sector plan. I'm pasting it right there. And we try to keep it relatively condensed just so people can read it easily and quickly. A couple paragraphs overview, short description of the process, the strategies and the tactics. How we like to do it is, and we can talk a lot about it a little bit more at the next meeting, is, we clearly had some tactic or strategies that ranked higher than others. Do we want to leave all the strategies in there, or do we want to drop the lowest? Generally, we suggest people leave them all in and just delineate which ones were the highest rated and which ones were a little bit lower, just because we know we don't have everyone in the space that attended these meetings and were able to participate. And last thing we want to do is drop a strategy that one person really would be interested in 3 months from now, but we for whatever reason didn't reach them now. So we generally try to keep everything in, but we can talk about that next time. And then we'll review that draft next time. We'll send it out in advance and we can review it before the next meeting. I think, this has been generally a pretty small group and we've had good involvement from the people from this group. So hopefully nothing is going to be a surprise when we have the draft. And then that will be it. We'll have the strategies and tactics completed. And then we transition to implementation, and that's where the fun stuff begins, where we start trying to identify and figuring out how can we get, say, a marketing agency or a brand agency to help us develop our brand and what that might look like, and the other priorities that we've identified throughout this process. So I'll also reach out to try to get the national plan mass media person to join us, and hopefully she's available and is willing to do it. If not, I'll try to find someone else from the national plan that could maybe speak to what they've done and are doing. I know that this is a priority for that group as well. So any questions about that process, or do you have any announcements from your organization that you might want to let other people know about?
I just had a quick question about funding. So when we get to this, how is there a budget tied to this? And I may have COVID brain and we've talked about this and I don't remember, but what are we anticipating budget tied to this, and how do we want to approach fundraising? Because that's also my wheelhouse too. So
yes, this is a great question. So we have funding specific to the development of the plan at the sector level. And then after that, for implementation projects, we basically take that on a project by project basis or a sector by sector basis. And so that is, for example, the healthcare sector, they were creating this program, it's called Walk with the Doc, or Just Walk, where they're connecting hospital clinicians to getting out to the public and getting people to walk and communicate and networking and things like that. They got some funding, small amount of funding from I can't remember what group ended up funding that, but they funded that initiative. And I'm submitting a grant in about 6 weeks that would create a referral process for physical activity within hospital systems. And then sports sector, we're doing some other very specific things. So for implementation projects, we're on basically a project by project basis. Okay. With that being said, I am always on the lookout for a foundation or some large funder that would want to give us, a significant amount of funding to fund implementation projects, across multiple sectors at once. So.
Yeah, I think we should get you on the speaker circuit and get in front of foundation folks and funders and just have your spiel to go in front of them to see who bites. Because this is so big and comprehensive, and I like the idea of individual projects kind of, funding them, but funders need to understand how it's part of a much larger picture. And so doing some sort of a speakers bureau where some of us are able to speak on behalf of this to potential funders and corporate folks should be somewhere in the work plan.
Yeah, absolutely. I can, and I appreciate you willing to help us do that. Okay, yes, we're a minute over. Sorry, everybody, for taking us over. Thank you so much for your involvement. Stay warm and safe and healthy.
Thanks, guys.
See ya.
Bye.
Bye.